order at 1 o'clock, and do it. Joe, would you do the invocation?
The most gracious Heavenly Father, we just thank you for this day. We thank you for the wonderful weather. Just thank you for the opportunity to serve our tribe. Dear Lord, let us have clear minds as we take care of the business of our people. Guide and lead us, we make decisions. In Jesus' name we pray. Amen.
Amen.
Roll call, please, ma'am. Frankie Burgess.
Present.
Brian Warner.
Honey.
Bill England.
Honey.
Keith Austin.
Here.
Jack Baker.
Here.
Harley Buzzard.
Here.
Joe Bird.
Honey.
Sean Crittenden.
Honey.
Don Garvin.
Honey.
Wanda Hatfield. Rex Jordan.
Here.
Dick White.
Here.
Curtis Snell.
Here.
Denise Taylor.
Here.
David Thornton. Victoria Vesquez.
Honey.
David Walkenstick. We do have a quorum.
We need approval of the minutes of July 12th meeting.
Make a motion they be approved. Second.
All in favor? Aye. Okay, and brings us down to reports. We'll start with the Claremore Service Unit.
Hello.
Well, I don't think I have any big news from last time. Any questions or anything? I do the orthopedic contract. They're doing negotiations with the bidders right now with Hillcrest for the Tulsa area and Claremore area. So that's really about all that I have to say, unless anyone else has any questions.
Do we have any questions? Councilor Buzzard?
And you may not have any interaction with the people of Cherokee Nation as working with contract health. Are you aware of those people?
No, not really. Just I know they're there, and I don't know much about, the contract health part.
What is your position?
Ambulatory care manager.
Ambulatory
Yes, yeah, and contract health, that's under the administrative officer.
Okay.
Okay.
On that note,
Yeah.
thank you.
Any other questions? Thank you.
Thank you.
And Miss Connie Davis.
Good afternoon. I think an exciting thing she may have not realized, when you're in the fire, you don't remember these things, but I attended a Claremore Indian Health Board meeting a couple of weeks ago, and they have a new nursing director there, and they have turned that ER around, and she's got left without being seen down to, I feel challenged now. I'll just say that. Brian Hell was there, so we felt very challenged by some of the things that they are doing there. So you should hear some positive things from your constituents in that area. I was impressed, so. All right. We'll start. It's been a busy month. We're reporting for the month of July. Before I start, I would be a big failure if I didn't introduce our acting medical director, Dr. Jim Stallcup. Come on up, say hi, don't be afraid. He's doing a fabulous job. He's hit the ground running. He served as the medical director for both Bartlesville and Nowata for several years, and his most recent task was the CMIO, or the Information Medical Director, for our Cerner project and implementation, and he even agreed to come and help us with this medical director role in the middle of all that. And he's fun, and he's smart, and he loves patients. He's very innovative.
You're making me blush. This is the first time I've been up here. No, I'm really excited. I'm really, we talked a little bit last time. I've gotten to see Dr. Montgomery 3 times now, I think, in the first 3 weeks, and I've probably had another 1,000 or so phone calls to him. But I'm really excited to get the opportunity to come up here and help.
We're glad you're here. Thank you. Okay. Cooey Health Center has 100 or had 102 new or reactivated charts, showing how busy we are there at that center. Public Health Nursing helped with Camp Cherokee in Claremore and Grove. At Sam Hyder Health Center, the staff helped with Benita and Salina Kids Camp and helped with Beat the Heat Run in Salina. Council members from the Eastern Band of the Cherokees toured the facility and also at Hastings. Three Rivers Health Center participated in the Wagner Community Meeting and shared information on the Affordable Care Act. At the Veneta Health Center, 162 new or reactivated charts were in July. They also hosted a blood drive and welcomed a new provider, Gara Trammell. She's a nurse practitioner. They also helped with the summer kids camp. Wilma P. Mankiller sponsored a Relay for a Life team, and they placed second in Adair County, raising $9,801. That's very commendable. And they hosted a blood drive. In Tahlequah at Hastings, Cherokee Nation EMS received 2 new GSA ambulances, which were in desperate need. These had hundreds of thousands of miles, and as you're aware, they're not on highways all the time. They're on rural country roads up and down the hills, so they take a battering, and so we're very grateful that we were able to purchase those. We also sponsored with OSU Operation Orange, which it was a huge success with over 70 total students participating in the event. And this is designed to encourage students to consider careers in healthcare. We sponsored it here at Sequoia, at the Sequoia Gym. And we even had Eagle Med here to just enhance those services and encourage participation in choosing a career in health. Our collaboration with the University of Oklahoma Center for Creation of Economic Wealth is continuing with our application for funding from the Native American Business Development Institute to possibly bring fruition the proposed Health Innovation Center for Cherokee Nation Health Services. And this is in collaboration. Brian Hill and I both sit on that, as well as Jay Calhoun and John Waldorf from CNB. So this could be some resources to come in and help with innovative ideas to improve our health system. We have a new service that we offer now at Hastings, and that is CT-guided biopsies, and we started those in July. In the emergency room, we saw 6,120 patients and a lift-without being seen rate of 5.3%. Not as good as Claremore. We transported 204 patients and performed 416 surgical procedures. Dental services had 7,900 total exams, and of those, 1,141 were emergency exams. At the Jack Brown Center, we had 26 patients in that month. And let's see, the program was recognized by the Board of Mental Health and Abuse Services with a certification with special distinction for achieving 100% compliance with all their quality standards. That's impressive. And that just speaks again to Darren Dry and his staff and their commitment to excellence for those patients that we serve. We also took a tour of the hospital in Cherokee, North Carolina at the request of Speaker Byrd, and that was very, very exciting. We got a lot of great ideas of things we want to bring back here and incorporate the cultural aspects appropriately into our facility, and we appreciate their hosting us and that ability to tour that facility. We also attended the IHS Area Director Awards. Several Cherokees were recognized for even over 40 years of service at that award ceremony. Dr. Mera again was recognized for his excellence in healthcare. Our quality department staff received recognition, and the gentleman's name from Veneta, who's a security officer, his last name's Sunday, was recognized for outstanding service to that community. And got an email this morning, and the emergency generator was properly installed this weekend and working. And so we're happy to have done that. That concludes my report. If you have questions, I'll be glad to attempt to answer them.
Do you have any questions? Counselor Taylor?
We had talked a couple of months ago about possibly picking up a drug for ADHD. Strattera was the one that you mentioned to me. I just wondered if there had been any progress towards carrying that, or what was the outcome on that?
Oh, so it has been added to the formulary.
Okay.
Thank you, Jeff.
And then also, I had become aware of a collaboration with Walgreens at Intertribal, and I mentioned at the last meeting that we were at, this health meeting. I don't think you were here, but I did bring it up, and I wondered if anybody had checked into that. What it was they would provide the medications for Native Americans. It was a collaboration between Walgreens and the tribes for medications that the tribes did not carry themselves. And I wondered if anybody had followed up on that.
Actually, Denise, I have a conference call with Jim tomorrow.
Very good, okay. You're making me happy today. And the generator makes me happy too. I'm glad we could finally bring that online.
Yes, me too.
Okay, thank you. I'm done.
Any other questions? Counselor Besser?
Yes, Connie, I have several questions here. One is about our mental health behavioral specialist. And Jay, are we actually recruiting somebody for that position?
We are looking,
The
yes.
last time we had people come over from another clinic here to take care of that.
And that's still what we're doing. We have they're rotating the shifts, as I understand it, sending from Claremore.
Okay. Then, of course, I still had some questions about Cerner. Is there any way that you could give us or the committee what we've spent on Cerner so far and any outstanding contracts that we have?
I think we would have to do that because of the terms of the contract in
and
an
you can stamp it
executive.
You can stamp it confidential, that's fine.
Okay.
But I'd just like to see what we spent on Cerner and if there's any outstanding contracts for Cerner now. Still have some concerns about the operations of it and what we can and cannot do. I haven't got with you on those, but I will at some point in time. Vacancies, I know we still have a lot of vacancies, go see it on your reports. What concerns me, and I think this has always been a concern of mine since I've been on the council, is what do we do with those dollars that we budget for those vacancies? You know, if you got 200 vacancies, an average of $30,000 a year, you're talking about a lot of money that's earmarked for those particular vacancies. We had talked about one time of using part of those dollars, but we never come to any fruition on that to do it. But I still have that concern. You know, we have vacancies after vacancy after vacancy, and you go ahead and put that into your budgets every year, and there's probably $600,000 to $1 million that's tied up. And I wish we could use that money some way, but, and I don't know that we can't. I know we've never done it at the Cherokee Nation. We always budget for vacancies. But that's been a concern of mine for years because we had some higher paid employees, and we'd have to budget those things every year. And it seemed to me like it's a waste of money tied up when we're probably not going to fill them anyway. But I don't know, it's something to think about. I'd like for some of the people on the council committee to think about it, to see if there's something we could do with those dollars, because they're just tied up dollars, what they are, because they're encumbered dollars. So
I think a lot of it we have to, as I understand it, is we have to leave it that way or we would be unable to recruit for that position. For example, we had 2 physicians, a husband-wife visit in the month of July. We thought they wanted to come work at Hastings, and we do have vacancies there. And they ended up touring Veneta and Salina, and turns out that's where they want to go work now. So if we would have obligated those funds to something else, then it wouldn't have been available to recruit those.
And I know, and we get that answer every time, and I know that's the fact, because we used to do the budgets when I was the director here, but it just doesn't seem right to encumber 200 vacancy salaries for a whole year, then we may not fill 10 of them.
Yeah.
Those are monies just tied up that could be used for other services. And I don't know what we could do. Anyway, I'd just like some of the people on the committee to think about that, because to me, there's a lot of money that's encumbered that never gets used. It's sitting out there, and just like Ms. Davis said, you know, they've got to have the money. If they want to hire 2 positions, it's got to be there. But with those many vacancies open, it concerns me that we're time and that much money for the whole year. But anyway, that's something to think about. But the budget hearing is coming up.
I think you'll see that the vacancy rate go down after the first of our fiscal year.
Okay.
I'd like to take the opportunity to recognize Stephanie Wycliffe in our recruitment office. She has done, we're down a couple of positions in the recruitment office, but she has stepped up, and she's got a new assistant named Lauren Redden, and they have done a phenomenal job. They have several docs lined up. I think Muskogee has all but maybe one of their positions filled. We've had some progress. It's like 2 steps forward, one step backwards in Salisal, but we're making some progress now in that department that we haven't in the past.
That's
And
the young position part.
yeah,
I addressed the vacancy. The other one is, on social media, I've seen this stuff about 12 and 12 are not paying their contracts through there. I'm sure you've probably seen the same thing, and it's just kind of bugging me. Is there a problem with that, or?
the problem, there is no problem on our side.
Okay.
Because it seemed like in 1 week, we got several complaints on that program and others on unpaid invoices, and it turns out it's not true. I wonder if sometimes when they see
can't
Cherokee
say everything.
Nation, right, it may be that some of Claremore's invoices haven't been
Okay.
paid. So I've asked the contract health staff to meet with them and clarify, and just to address something that a couple of months ago we had talked about, sending out information. We do that already. I didn't realize we had done that. And Brett hopefully remembers to bring the packets. But we send a packet with very specific instructions on how to bill contract health, including having the right date of service, the right coding on there, of course, everything. And the majority of things that aren't paid timely fall into those categories.
So you'll
And
pick
so,
those up. You'll know they're not paid on time.
well, yes, but it's not because they're not invoiced correctly. We don't want to pay on an invoice with, because that could get us into trouble.
The other thing, this is the last one I had, is on the $1 million grant that's coming through the nation on, for children.
The CHIP program, the Sooner Care.
I don't know if it's called the CHIP program or not.
Yes, it is.
But is it called the CHIP program? And I had just a little bit of correspondence with the media on the thing, and they were asking for some things, but I don't know that our people that are taking care of Sooner Care, those type of things, are really, and I know they got paperwork to do, administrative work to do, and then maybe they can, but I would think that they would get out and visit with the people that come to our clinics. That could help us more than anything, I think. And the other thing is, and I really think we need to target parents. I know the email I got is we want to look at children, which can benefit from it, which is fine, that's fine too. But I think if we're going to target people, parents need to be targeted on that, because they're the one that's going to make that kid or enroll that kid. So I don't know, just some thoughts about it, how we could get more kids enrolled. And it's a good program. I
Yes,
know
it
it's a
is.
good program. And they're right, we're missing a lot of kids that could benefit from those, the Sooner Care and the state care of insurance, so.
We
Anyway,
we have that expectation of our patient benefits coordinators in each clinic, that they specifically look at our pediatrics under the age of 19, and then anyone over the age of 65, to see if they're eligible for Medicare or Sooner Care, to try and capture every person that may not have a third-party payer source.
And that's good. I'm glad that we're asking them to go out. And I think they just need to go out and speak to people instead of waiting on people to come to them. They need to put them in there. So, anyway, that's my list of questions.
Okay.
Thank you. Thank you, Madam Chair.
Counselor Lay?
Thank you, Madam Chairman. Ms. Connie, and we just talked about the contract referral funding. You're going to separate that out for us and send it to us, I think. The dollar-
Yeah, I'll get to the email. I guess it was sent on Friday, and I was out and
Yes.
clarified what you're asking.
Thank you. And it's on Medicare, and you correct me if I'm wrong, I think I'm seeing and I'm hearing and I'm actually seen it, that there's every time, if you're on Medicare and you visit a clinic, no matter where, does Medicare get a dollar amount?
We bill Medicare, but Medicare doesn't benefit from us.
Right. Is $307 for each clinic visit sent to Hastings out of the Medicare budget? Out of the Medicare billing, I'm sorry.
And correct me if I'm wrong, Amy. If you are a Medicare patient and you go to one of our facilities, that facility can bill Medicare, I believe it's $368.
And it goes to Hastings, though, and not the clinic.
No, it goes,
Okay.
we break down, every month we get a report on the clinics of the their budget or their revenue.
Well, how much of it ends up at Hastings? Is it counted as a
Whatever's-
visit at Hastings?
No, if it's at Nowata gets the benefit. If it's at Hastings, Hastings gets the benefit.
Okay. So the money itself stays in the clinic as far as accounting is concerned?
Yes,
Okay.
yes.
The Claremore outpatient contract referral funds that was taken from Claremore for Cherokee citizens, does it stay and be spent on citizens from the Claremore jurisdictional area, or does it come to Tahlequah and it's included in the total fund for contract referral?
It's total funds.
Why is that? Because it comes from Claremore, it comes from me, and you guys at Hastings already have a contract referral fund, a big one. So I don't get it.
I would say, Amy may want to come in here, but because we see, Tahlequah sees patients from even outside the 14 counties. And so is it just in one pot now, Amy?
It's all in one pot. So, and we've been through this before, there's a 96% rate that are approved, and that approval process happens in Tahlequah. I feel like that, here's what I'm getting at. It seems like to me that folks outside of the Hastings jurisdictional area, in other words, Claremore, are not getting filled at the 96% rate or whatever we're claiming that the folks in Tahlequah or Sequoia County or Adair County are getting. Is that correct?
That is incorrect.
Okay. So how is it then that I get so many phone calls from folks who say, they have to be denied at Claremore first, still yet, and then they got to go through the process here at Tahlequah to get either deferred or denied again? I'm just asking.
It shouldn't be that way because we have dedicated staff physically at Claremore processing claims the same way we do in Tahlequah or where.
How many patients do you see from, say, Copan at Hastings? Very few, maybe none.
I couldn't tell you.
And so, well, I'm just guessing, very few. And so why did that money come out of Claremore and get put in the pool fund at Tahlequah? That's
Again.
all I'm asking.
Can I clarify one thing?
Oh, yes, please.
I told her I might be late, so I just went in. The money let's take Claremore out of there. So the money for Bartlesville, historically, it all comes centrally, and then we spend, each clinic gets their budget, and, we have that, we track it internally as to estimated referral, volume, and it varies by payer mix. So it goes back, like, for instance, Jay historically has a lower cost per referral because they've got a payer mix that has more Medicare patients.
Brett, I know what you're getting ready to say, but let me state this. None of you have ever given me the breakdown of the percentage approved north of the Claremore line versus Hastings. You just give me one great big number.
Well, we track those, we have a total approved, denied every month.
Yes, you have a total.
I can.
Give me another.
Break it
Give
down.
me
I do it by
another
clinic.
number.
I do it by clinic. I just total them up into one big spreadsheet. So, and I have that spreadsheet goes back to May of 2004.
I understand, but you're never giving me the other number that I've asked for before.
We have, I can get you that. That's.
I've asked for
But
it.
that
How many
includes,
times have I
now
asked
for
for it?
no water though, it's just going to be on the outpatient side of the house. You know what I mean? For no water and
I
for Claremore and all
understand, because
those.
it's only an outpatient.
Right.
Yeah.
I have that. That's, it's been in some reports in the past, but maybe not in the last few years, because it's been pretty,
Okay. That's what I'm asking.
okay.
Thank you. Eye doctors at No Water or Cooey.
I thought we had one in line for Cooey Scooey, so I'll have to follow up.
It's been several years now, I've been hearing the same thing. I've got one in line, He's coming, in fact, I saw one at Cooey one day. He lasted about a week and went to Stillwater.
Did you do to him?
I don't know. I was
I
as
don't-
nice as I could be.
We had a payback, didn't we, coming? Do you remember?
We lost the other because his is in Stillwater and he got offered something closer to Stillwater.
Oh, that's
We
where
drive
it
back
was.
and forth all the time. There's nothing we can do but lose him. And that happened.
Dr. Lighthizer said that the position in Cooey has been filled and they're looking for another float position so that Nowata can have a full-time provider instead of having a share.
So, I'm sorry, I didn't hear
The
Doc.
Cooey Scooey position has been filled, but NSU provides a floating position, so when the optometrists at the respective clinics are on vacation or sick, there's a floater that fills in those gaps, and so they're looking for that position now.
Okay. Is that person in place yet or oncoming? Coming on board?
I don't know the status on it, but I did speak with Dr. Lighthizer and he said that it has been filled. But I don't know what the onboarding timeframe is, sir.
We'll try to email you and follow up later this
Okay.
week on that.
And thank you. Has it been 1 year since Cerner has been installed?
We survived a year.
How's it doing?
We're 11,000, this report will reflect well over 11,000 visits ahead of last year's volume.
How's your revenues going?
We're still working on some Medicaid visits, but we're projected to catch up, to be at or exceed last year.
Get things billed out in time, properly.
We're trying everything we can.
If you could do that, what would the numbers look like?
It is difficult to say.
The report that's in the book, it goes up, does it go up through June? Is that what it says? To June or through June?
Through June.
When we went to the accrual accounting method, you said you'd be 3 or 4 months behind. How are we getting a good June number?
We're actually 3 or 4 weeks behind. It's
Okay.
not months. And as a matter of fact, right now, the way it works is we have to get all the payments that were posted the previous month completed. And we just got those finished last Friday for the month of July. So I'm starting the closing process, which is multiple steps and it takes some time to get done, but that's the schedule.
So the October through June number is a good one?
We're about 1.3 million behind where we were
Yeah.
as of June of last year. So we're coming along, we're getting closer and closer to where we were last year.
Thank you. We discussed a case in which Brett and I talked about for a long time about prosthesis device. And the slowness of how that took place really kind of bothers me. And I don't know what could be done to speed up that's another one of those contract referral things. Medicare paid the lion's share, and I forget now, I think it was 80%. Ours in was 20. And I guess the thing was pretty high priced, but I guess they all are, so.
Well, we've never seen prosthetic that high. That's what. So we had to do a little research and talk with the
So
prosthesis.
Prostitution.
That-
I'm not going there, Doc.
Thank you.
Thank you.
Counselor Vasquez?
Yes. Bonnie, a few meetings ago, I asked about you guys helping us to compose a letter to give to clients who are getting repeated collection calls and things, a letter that they could send to the provider or whoever to stop that because it's in process of being paid. Whatever came of that letter?
We have a draft. I didn't know if this had been addressed in the previous committee meeting, so.
No.
Okay, let's get that out today. We'll send it to you guys for your review.
Okay, thank you. Thank you.
Any other questions? Counselor Besser?
I have to follow up with, and Jack Baker can help me with this. Jack, is that 1.3 million, is the question that you asked last committee meeting about things that they haven't collected on?
Things that have been
That
billed.
are outstanding bills? I think last meeting you asked, you said it could be done.
Well, what I had said was that it had been accrued
Right, okay.
to be billed.
So is this
In the
one-
past, going back about a year or so ago, when you changed the reports, initially it was what was accrued to be billed. And so we had asked if we could get both reports.
Oh,
The accrued,
Yeah, that was a question.
the accrued as well as the actual payments.
the accrued versus the cash.
Right.
So you
So two
collect
separate.
year-to-date cash collections as well as the accrued revenue?
Yes.
Okay.
So that 1.3 million doesn't address that question those times?
No.
Okay, that's fine. All right. Thank you, Madam Chair.
Counselor Alston, did you have a question?
Yes. Connie, we communicated about the audiology hearing test, and the answer was yes, a year or more. I spent the first 4 years of my life almost deaf and got it corrected, so I really relate to people who struggle with their hearing. And a year is too long. What do we have? I don't see any of these positions as audiologists. What are we doing in order to get that down?
We are outsourcing some of those, but Dr. Urquhart, right? That guy works really hard. He stays booked, and he tries to triage every new referral or appointment, and the priority is going to children right now and making sure they get the hearing aids or assistance that they need.
Okay. That's wonderful for those people who are getting seen, but those people waiting a year, we have no plan.
Just have to wait and get them in as we can.
Okay, we need a plan.
Any other questions?
I just have a comment. Give us an update on Hastings Hospital, groundbreaking, anything new? And then what did you gather from your trip to North Carolina? Because that is an awesome hospital they have there.
We begin meeting with department heads tomorrow for the next 2 or 3 days, going over their specific or respective clinic designs and layouts. Obviously, the site location has been made, and so now we're just designing what it looks like or how the layout will be as we go up. I'm hoping within the next couple of weeks, they will give us a real concept that we can set a groundbreaking date.
I'd like to get with Dr. Grimm and take a close look at how we are competitively with other health facilities as far as pay, because when we bring in good docs in here and they stay with us a few years, I want to look at how we can maintain those. I think we do a good job. I really commend Stephanie Wycliffe for the job that she's doing. But once we get them here, you know, what else can we do to add that incentive to keep our good docs and good people here?
We have a plan that we will roll out to you guys probably over the next year, and I think it'll be something that will make everybody happy.
Okay. Thank you, Madam Chair.
Counselor Walking Stick?
Hey, Connie, just kind of echo what Chief Byrd said. Visiting with some of the administration, they were talking about just having just a regular building, 7-story, 480,000 square foot building. And when you go down to Cherokee, North Carolina, you see like a woven basket design up front, and the art and the detail that goes into the building tells the story about our people and who we are as being Cherokee. And I would hope that when you guys are getting these renderings from architects, that this is more than a hospital, but it's telling our story of who we are. We live here, we're going to be here for the rest of our lives till we die, but we like something that would relate to us as Cherokees.
No, we completely agree, and Gina Leah did accompany us on that trip and had some great ideas that she thought would be appropriate for our facility. I'm really excited to see what she comes up with.
Okay. And another thing is, I think I emailed you, in the behavioral health department, having a licensed psychologist that can issue meds. So we're contracting that position out.
It's a psychiatrist you'd ask about?
Psychiatrist, yeah.
Yes.
Now, is it sufficient, us contracting out, or is it better if we hired someone in-house?
Dr. Pogue has been with us well over a year and has done an incredible job. We're quite pleased with his services. And then we have the mid-level nurse practitioners who can also have some prescriptive authority.
For all drugs?
Well, in behavioral health, they have, they kind of limit themselves to, they're not limited, but by practice, they choose to do more of those medications for depression or.
So just minor meds, but nothing. If you're bipolar or schizophrenic or something, that they can't issue meds for that. You have to contract that out to the psychologist.
It would depend on the medication. That's kind of a big question, and every case is so unique. I wouldn't want to say exactly that that's all they can do.
Yeah. Well, just the talk I'm hearing from a few people, not a large group, but a few, that they can't get in. These are students that are classified as being bipolar, and they're having a hard time getting to our clinic to see a psychiatrist to get issued meds for their sickness or whatever that is. They're diagnosed. So I guess my question is the psychiatrist, is it sufficient to handle the caseload of what we have in Cherokee County?
This is the first I've heard of anyone having a challenge getting into those services. So if you'll get me those names, I'll check the status of their appointments and make sure they get in.
Okay, sounds good. Thank you, Con. Thank you.
Councilor Vasquez?
Yes, thank you. I had one more question that Walking Stick brought up about the clinic in North Carolina, and I also got to tour it and was really impressed. Is it too early to ask if Gina and you all will be including the National Treasures and Cherokee artists, going to them for design ideas for our clinic or our new addition?
I don't think it's too late to ask.
That's a good idea. Yeah.
You should be involved.
Thank you.
Any other questions? Comments? Okay, thank you.
Thank you.
Moving on to old business, we have none pending. New business, none pending. Announcements, the next meeting is tentatively scheduled for Monday, September 12th at 1 o'clock. Any other announcements? Motion to adjourn?
Make a motion to adjourn.
Second.
All in favor?
Aye.
We're adjourned.